I'm Dr. Wahls. I'm so glad you're joining me today. Today, we'll talk about autoimmunity and the many things that you can do to begin to get your life back under control and to once again have a rich and full life. Managing autoimmunity in the current healthcare crisis. My goal is to create confidence and optimism and show you that a path for getting your life back does exist for you and for your family. Now, here's what you're going to learn today. Why the delay to diagnosis of your autoimmune condition often occurs, the limits of disease-modifying drug treatments, known as DMTs, what is common across many autoimmune conditions, and the risks from not addressing root causes. Now, I'll pack as much information into this lecture as I can, plan for about an hour. I'll also talk about DMTs in the time of the COVID-19 pandemic. I'll extend an invitation for those who are seeking more support in their health and healing journey. Now, my gift to you, if you stay all the way to the end, again, stay with me until the end for my handout on the Wahls diet and reducing your COVID-19 risk. First, I want you to reflect on how well your symptoms are controlled. Have you had symptoms for years, but no specific diagnosis yet, and you've been seeing physician after physician, and you know you have autoantibodies, but not enough abnormalities for your physicians to make a specific diagnosis? Have you been newly diagnosed with a serious systemic autoimmune condition and have been told to consider disease-modifying drug treatment because of the risk for progression and potential for disability? Have you been placed on a disease-modifying drug? Perhaps you've gone through several, but you continue to have symptoms, and you see that you are steadily and slowly, inexorably declining, and you're afraid you're going to soon be unable to work. Or have you been well controlled, and you wish your physicians would talk with you about the strategies to get off those disease-modifying drug treatments? And what you're realizing is that your medical team maybe does not understand, is not helping you address the root causes for autoimmunity. And that, of course, is very common. So again, how has your current medical experience worked out? How many years did it take you to get a diagnosis? The reality is, for most people with an autoimmune problem, it will take decades, 5 to 15 years. How many physicians did you have to see? On average, it's 5 to 8 physicians. And how much money did you have to spend with your out-of-pocket expenses? Even if you had great insurance, often it's tens of thousands of dollars because you had to see so many physicians and get so many additional tests. And how frustrated are you by your experience to date? So which best describes you? You have symptoms for years, but no clear diagnosis. You have an autoimmune diagnosis and have been told to take immune-suppressing medications, also known as DMTs. You've been on DMTs many years, or you're over 60 years old, you take DMTs, you're a smoker or have been in the past, you're exposed to air pollution, or you have some type of chronic lung disease, allergies, asthma, chronic cough. So I'm an academic internal medicine physician, and I was diagnosed with multiple sclerosis. And I did many things right, but I also did quite a few things wrong. I'm going to share my autoimmune story. Now, when I was diagnosed with multiple sclerosis, because I knew it's a progressive disease, and I'm an academic professor of medicine, I wanted to treat my disease aggressively. I gave all the responsibility for my health to my physicians, and I sought out the best MS center that I could find in the country, and I went to see them. Again, I did research. I identified the very best multiple sclerosis center in the US. I went to see them, saw the best people, took the newest drugs, and I discovered this the hard way, that even though I saw the best people and gave all the responsibility for my decisions to my medical team, I got steadily worse anyway. I was in that tilt recline wheelchair. And then I got so weak, I was unable to sit up in a regular chair. I was beginning to have brain fog. I had trigeminal neuralgia with electrical face pains. that were like electrical jolts down my face. And it was a very grim future. I would probably become demented, bedridden, and have to live with intractable pain. And so I was determined that I was going to do all that I possibly could to slow my decline, because I had 2 young children. So again, I made the decision that I was going to do everything I possibly could. I harnessed my discipline and my determination and my resolve to find a solution to slow my decline. I read more basic science. I began experimenting on myself based on what I was reading. I read more ancestral health and functional medicine principles. I read evolutionary biology. I integrated all of that stuff: basic science, ancestral health, functional medicine, evolutionary biology. And what I saw was that the evidence was very clear that we had this mismatch between our lifestyle and our environment that led to these lifestyle-induced chronic diseases: heart disease, stroke, diabetes, obesity, metabolic syndrome, insulin resistance, lung disease, many cancers. And you could also add autoimmunity, mental health in that paradigm. And I learned that diet and lifestyle create health or disease, depending on our choices. That the environment had diverged from what our DNA expected. And that led to our cells not running the chemistry of life properly, which leads to symptoms, which leads to damage, which leads ultimately to a diagnosis that physicians like myself could make once we saw our patients in our clinic. But if the root of these problems was the lifestyle that has diverged so radically from what our DNA expected, I discovered functional medicine. And I love this tree that looks at the environmental factors: sleep, exercise, nutrition, stress, toxin exposures, microorganisms, relationships, and how that interacts with the genes that we have and the events of our lives. That lets our cells run the chemistry of life properly or not. That leads then to signs and symptoms that lead to diagnoses. And by addressing the environmental factors and providing support when needed, we could improve how our cells run the chemistry of life and often stabilize chronic diseases, including autoimmune diseases, and then often regress those chronic diseases, including autoimmunity. So my healing journey taught me, again, I'm a young physician. I'm fired up about the modern miracles of modern medicine. I get diagnosed with MS. I see the best people, take the newest drugs, and I become profoundly disabled anyway. But thanks to the power of ancestral health, evolutionary medicine, functional medicine, I'm able to get my disease stabilized and then regressed. And in fact, I'm able to do an 18.5-mile bike ride with my family. My pain is gone, my brain fog is gone, my energy is boundless. And I have my life back. And helping others avoid my mistakes became my mission. I began doing clinical research at the University of Iowa, testing my protocol in others. I have been so successful, I have $1 million research grant funded by the National Multiple Sclerosis Society. I'm a leader in the ancestral health and functional medicine movements. And I ran a therapeutic lifestyle clinic at the Iowa City Veteran Affairs Hospital for many years. And we have published many multiple peer-reviewed publications of our many research studies in scientific journals. Again, my healing journey. Despite seeing the best people, taking the newest drugs, when I gave my physicians all of my control, I went relentlessly downhill, becoming so weak I could not sit up in a regular chair. I had progressively severe trigeminal neuralgia, progressively severe electrical face pains. I was beginning to have brain fog, had severe fatigue. Fortunately, I kept reading, I kept learning, I kept discovering, and I was able to discover evolutionary medicine, ancestral health, functional medicine, and integrating all of those concepts, I created a diet and lifestyle protocol that stabilized my disease and then steadily regressed it, restoring my function, getting me back to my previous life. And this was really the birth of a new approach, and to inspire and create hope in others. So again, integrating what I learned, the ancestral health principles, evolutionary biology, cellular health discoveries on basic science, functional medicine, rehabilitation and addiction science, and the science of behavior change. And we created that into the Autoimmune Intervention Mastery Program. Now, the secret number one is that drugs treat symptoms, and they may be very effective at treating a specific symptom, a specific molecular pathway, but they do not create health. Health is a reflection of our lifetime of diet and health behavior habits. Drugs will not address the root cause of cellular dysfunction. Secret number two, drugs, though they may be effective at treating a symptom, they do not treat the mismatched diseases very effectively. They do not provide what your DNA expects. They do not change your lifestyle. They haven't eliminated the junk food. They haven't eliminated the tobacco or the air pollution. They haven't instituted a health behavior change, such as a stress reduction practice or exercise. Secret number three, you are in charge of your health. Aligning your diet, health behaviors, your lifestyle choices, and your DNA can only be done by you. It can't be done by your physicians. It must be you. You must be willing to do the work to change your diet and your lifestyle. Now, my personal discoveries, and I validated these in my clinical practice at the Veteran Affairs Clinic, in my primary care clinic, in my traumatic brain injury clinic, and in the therapeutic lifestyle clinic, and in my clinical research studies, and in my private practice. The people that I took care of had obesity, diabetes, mental health problems, many different types of autoimmune issues, traumatic brain injury, post-concussion syndromes. The symptoms we took care of: severe pain, brain fog, irritability, anxiety, depression, elevated blood pressure, elevated blood sugar. And many of my patients were living on food stamps, and they had severely limited financial resources. And yet, we were able to teach them how to successfully implement and then sustain major diet and lifestyle changes. That often led to steadily improving blood pressure, steadily improving blood sugar, steadily improving mood, reduction in pain, improvement in quality of life, reduction in the amount of medications that were required, reductions in the doses, and often a reduction in the number of meds. So who have we helped? And in my millions of followers, people who've seen my TED Talks, who've bought my books, who've been in our clinics, it's this long list: autoimmune diseases, multiple sclerosis, rheumatoid arthritis, systemic lupus, inflammatory bowel disease, Hashimoto's, Graves' disease, vasculitis, scleroderma, myasthenia gravis, fibromyalgia, Parkinson's, anxiety, depression, fatigue, chronic pain, high blood pressure, obesity, diabetes, and many different types of neuropathies. Do you have any of these symptoms? Do you have any of these types of problems? Now, we've done this in clinical trials where people have come in, we've done baseline assessments, implemented them on these diet and lifestyle programs, and we're able to show a dramatic improvement in quality of life in others with progressive multiple sclerosis, secondary and primary progressive MS, and a dramatic reduction in the severity of fatigue. We've also showed a dramatic reduction in anxiety and depression scores, and a dramatic improvement in thinking, verbal reasoning, and nonverbal reasoning scores. And we've done 3 trials. Our 4th trial was funded by the National Multiple Sclerosis Society, comparing a low-fat diet to the Wahls diet. We're just starting our 5th study now. Now, more neuroscientists. When I first started talking about this, all these concepts 12 years ago, there were many physicians in the neurology community and in the internal medicine community who pushed back and said that you can't use diet and lifestyle for everything. But in these intervening 12 years, we understand that the microbiome is a big driver of health. And the food we eat is the biggest driver of all for your microbiome. That the food we eat and the activities that we do turn our genes on and off, and can turn on disease-promoting genes and turn off disease-promoting genes. That tobacco and air pollution can turn on genes that worsen disease or turn on disease accelerant genes. In fact, now the leading neuroscientists agree that it is key to implement diet and lifestyle, that using a disease-modifying drug treatment is not sufficient to protect the person with serious autoimmune conditions, neuroinflammation. A serious autoimmune problem nearly always has some inflammation in the brain, leading to anxiety, depression, mental health symptoms, and higher rates of cognitive decline. And that for anyone with a serious autoimmune problem, that if they would also address cigarettes, diet quality, exercise, that would be a vital part of reducing their risk for early depression, anxiety, memory loss, declining function, loss of employability. Everyone, when you have a serious autoimmune problem, needs to begin using diet and lifestyle. They have to begin addressing that mismatch between their lifestyle and what their DNA expects. This is a truth that the most current autoimmune specialists understand, is that DMTs alone are not enough to protect their patients. Everyone should be getting trained on diet quality, physical activity, smoking cessation, stress reduction. Is your medical team giving you that training? Are they helping you make those changes? And people ask, well, what about DMTs? Yes, depending on your clinical circumstances, DMTs may be necessary now. If you can't get good control of your autoimmune problem, yes, they may be needed, but they will not be enough. So if you're not yet on DMTs, people ask, like, what should I do now in view of the COVID? So this will depend on how severe the disability is, how severe the disease activity is, and that will be different if you have looking at MS or inflammatory bowel disease or psoriasis, scleroderma. It depends on the disease and the severity of the disease. And it's true, DMTs, if you read the risk profile, increased risk of infection is nearly always listed. And sometimes they are life-threatening infections. And if you're on a DMT and you stop the DMT, then you risk a severe rebound or worsening of the underlying disease. Now, it may be that some DMTs may reduce the risk of cytokine storm. Others may increase the risk of cytokine storm. This is a new area that we do not yet fully understand. Clearly, my suggestion to my tribe is you want to address sugar, smoking, and eat more vegetables. Get rid of the sugar, get rid of the smoking. If you're on DMTs, I often get asked, should I stop DMTs? Because after all, DMTs increase the rate and risk of infection. But if you stop DMTs abruptly, you increase the risk of severe worsening of the disease. So for my patients on DMTs, in general, I tell them to stay on their DMTs. And that some DMTs may reduce the risk of cytokine storm, some may increase the risk. This is an area we do not yet understand. But absolutely address smoking, sugar, diet quality, stress reduction, and transition to less potent DMTs as appropriate. And depending on your age and how stable your disease has been, it may be appropriate to transition entirely off the DMTs. That's a question to have, a discussion to have with your clinical team. And what about the risk of COVID-19 in that worse severe flare of pneumonia, needing a hospital, of needing intubation? Well, if you're a smoker, or if you have a lot of air pollution or lung disease, or you have a poor diet, which is a standard American diet or a standard westernized diet high in sugar, over the age of 60, you're sleep deprived, you have high cortisol, or you're on immune suppressing drugs. Those are the current risk factors for a more severe response. We do have some folks who've had wonderful success by implementing the Wahls protocol and the types of concepts I teach and the autoimmune intervention mastery. Beth Schultz had Lyme disease, had 9 years of steadily worsening function. She had seen the best people in the country, treated her disease aggressively, but found my work, implemented the concepts that I teach, and has gotten her life back and has changed her profession so that she can help others implement these concepts. Tony Farrell, likewise, had optic neuritis, multiple sclerosis, severe visual disturbance, and severe loss of function. He was going steadily downhill, but he too found the Wahls protocol and got his life back in order. And along the way, he lost over 150 pounds with dramatic improvement in quality of life, in quality of improvement in his metabolic function, improvement in his blood pressure, and he's made it his mission to help others understand what they can be doing to restore their health and their function using the Wahls protocol and the concepts I teach in autoimmune intervention mastery. So improving diet and lifestyle are absolutely key for addressing mismatched diseases like autoimmunity, like high blood pressure, like diabetes, obesity, insulin resistance, metabolic syndrome, heart disease, lung disease, many mental health problems, and many cancers. And they are probably important in reducing your risk of severe side effects from the COVID-19. Now, again, I can't say that these results are typical. You may have different results because you are a unique combination of your DNA, your environment, our conductive environments, and your choices. So a great place to start is to ramp up your green leafy vegetables, more deeply pigmented vegetables and berries, and more cabbage, onion, and mushroom family vegetables. Now, how is your current medical team serving you? How optimistic are you that you have the tools you need to stop your symptoms, to stop your progression, and get your life back? Who is your guide for this journey? And how empowered do you feel to make these choices? And do you know what your next step is? And now, unfortunately, many physicians and many medical professionals do not understand how to treat mismatched diseases and autoimmunity. They do not understand how to help people change their diet and their lifestyle. Now, the functional medicine care costs money. You can get a functional medicine consultation. You can get advanced laboratory testing to understand how your cells are running the chemistry of life. You could get health coaching to support you in making these recommended behavior changes, have close follow-up, and close support to sustain these behavior change, to sustain these results. But often this is not available in your community. You could come see me. And yes, I do have a limited private practice. I have a very intensive intake process, and we offer 6 months of support. And you can find that at terrywahls.com to learn more about my private practice. And yes, we would love to see you and support you. Now, the 3 most important things for you to know right now: diet and lifestyle is key to strengthening the immune system so it can properly heal you and repair you, and to treat the mismatched diseases and autoimmune related problems. If you're going to be healed, it's your immune cells that will have to heal you and stop attacking you and instead repairing you. It's your daily choices that are key in influencing whether your health is improving or declining. And are you ready to be all in to begin addressing the root causes of your underlying health problems? Are you ready to learn more? Now, more than ever, it's time to put your health first. Now, the Autoimmune Intervention Master Course is based on ancestral health principles, evolutionary biology, cellular health discoveries, basic science, functional medicine, rehabilitation, and addiction science, because we are so addicted to our harmful foods and our harmful behaviors. And the science of behavior change to help you be much more successful with making the needed changes to your diet, your behaviors, your lifestyle. The Autoimmune Intervention Master Course is 5 modules with many focused lessons in digestible bits of information, with specific activities to help you learn and master these concepts, and handouts to guide and support you. And this has been created for people who learn best visually, best by listening, or best by experiencing. There is a Facebook support community to help you celebrate your success. The 5 modules, module 1 is to create your inner game intervention plan. This is to help you address the mental aspects of the paradigm shifts so you can understand my story, how you could relate to my story, how you can reimagine your future life. Module 2 is to create your food intervention plan. This is to help you understand how to design a diet that better serves the needs of your cells so your cells can do the chemistry of life. We talk about how to do this either as a meat eater or as a vegetarian. We talk about how to make it more affordable and how to make it work within your current life and given your financial constraints and your time constraints. Module 3, create your physical intervention plan. In this, we help you understand your current physical limitations, how to assess that, how to create meaningful goals, and to begin to work forward on them step by step by step, how to find a movement professional to assist you and support you in your physical intervention plan. Module 4, your supplemental intervention plan. So this is about more than just food and exercise. There are many more things that you can be doing to support your cellular chemistry and cellular physiology. We'll talk about the concepts to consider when you're evaluating what supplements to use and what other complementary alternative strategies are helpful in restoring health and vitality for the person who has a mismatched disease. And in module 5, we will help you commit to health and happiness, to understanding how to have a good life, a pleasant life, a meaningful life, and to experience more joy and fulfillment in your life as you know it. And we'll give you 12 weeks of menus, recipes, and shopping lists to make this easier for you to succeed. We will give you the skills, you'll have the inspiration, you will understand that there is a path that it's possible to get your life back. We always have two choices. When we face a major challenge or loss, we often go through denial, anger, bargaining, then we get to acceptance. And perhaps you're at acceptance, that you know you have a chronic problem. Either you have a diagnosis or you have a serious diagnosis and perhaps are on the disease-modifying treatments. But you're still facing two options now. The first option is you can say, okay, I'm accepting my fate. I'm helpless and I'm powerless to change it. I'll just follow whatever my physicians say, and I have no responsibility. So it will be what it's going to be. Or the second option is you can learn all that you can and begin to take actions to create more health and more vitality for you and your family. You can begin to address the root cause of the mismatch diseases, of how your diet, your health behaviors, your lifestyle, your environment is at odds with your DNA, and how that mismatch has contributed to the development of your current symptoms and your current disease states. And you could begin to learn using the programs that we've created so you could address this mismatch. So thank you for staying. My gift to you, it's time to get your free copy of our highly acclaimed handouts, the Wahls Diet and Reducing Your COVID-19 Risk. Be sure and pick up that gift. Again, there's never been a more important time to make better choices to improve our health. Taking action has never been more important. There's more learning, more support, more transformation, more life waiting for you. Be empowered. Autoimmune, intervention, mastery, course. Begin taking your life back now. Go to terrywahls.com/aim. We look forward to seeing you there. Remember, if I can get my life back from being unable to sit up, having horrific levels of pain, to being able to bike 18.5 miles using diet and lifestyle, the very concepts that I teach you in the Autoimmune Intervention Mastery Program, there's every reason for you to be hopeful for you and your family. Take action. We would absolutely love to see you get your life back.